Happy year of the yin, water rabbit, and the year of the cat. I'm Dr. Robi Robinson. I received training, Five Branches University, and also AIMC Berkeley, as well as Life. And I'd like to say right now, apologies for all mispronunciations. There are probably going to be a few. We decided to find out what place a 2,000 plus year old Chinese philosophy has in the current and post-COVID healthcare objectives. When we included integrative medicine, the Wulong Wuxi has a solid position in both pandemic, diagnostic, and in traditional East Asian medicine modalities. Next slide.
Hold on just a second, let me share. So I will be doing the slides for today. All right. Oh, I can see you. Excellent. Hold on. And there you go, Robbie.
Okay. So, please go to slide 2. I found a definition for the term survey from the website apa.org, and it states that a survey is a study in which a group of participants is selected from a population and data about or opinions from those participants are collected, measured, and analyzed. Our work received an expedited review from Western Kentucky University and was conducted under the direction of Dr. Rick Grieve. We have no declarations. Slide 3. Our team conducted 2 interviews each with 12 acupuncturists during an early phase of the pandemic. We sought to learn their thoughts on acupuncture practices, relevant health trends, and how they came into being into their careers. Slide 4, please. Paper turning. The survey was designed to investigate the probability or the possibility of acupuncturist utilization of an ancient construct as a tool of working with and helping their patients' recovery. That seemed like a particularly relevant question during the COVID-19 pandemic. The researchers also wanted to learn what steps the acupuncturists took to become practitioners in such a unique field of medicine. Next slide, please. From a remote platform in 2020, from March of that year through October, we reached out to participants worldwide. There were lockdowns, sheltering in place, quarantines, and isolations in response to the severe illnesses, deaths, and complications due to SARS-CoV-2. Next slide. Our researchers sought to find out what were acupuncturists thinking about. They said that the pandemic, how to treat their patients, and how to manage public health challenges that ensued were on their minds. Next slide. This is the original video that we did for our capstone project. And we can move forward to the next slide. Next slide, please. Next slide, please. The sample size using 12 acupuncturists for N was a quasi-experimental design. Our pretest measure was survey and interview, and our control variable was knowledge of Oolong Yushi. Our quasi-experimental variable was the presence of wildfires, and our post-test measure was survey and follow-up interviews. Our outcome variable was qualitative themes expressed. Next slide, please. The interviewees cited people as having hectic lifestyles, food inequality, poor relationships with the natural environment, pollution, excess travel, lack of care in public health settings as being possible contributors to the rise of the pandemic. So slowing down or slowing down with work or play might help to ease or lessen the viral load. Next slide, please. We collected data from the subjects and analyzed to reveal that there was no significant support found for the Oolong Yushi hypothesis. A significant finding was found among the interviewees who were in proximity to California wildfires. Next slide, please. Post hoc investigation revealed that the acupuncturist's geographical region significantly explained the differences in their stated themes, and their location was included as a covariant to account for the theme differences resulting from the places of their education. And the place that they were educated in ended up not being significant or not making a significant difference. Next slide, please. Here are some quotes from our interviewees. You read them on the screen, but one thing that I thought was a standout is the Taiyan channel. Waterways in human bodies reflect the water balance of the whole planet. And that's an indication of us being in concert with our environments, regardless of how balanced or imbalanced our environments are. Next slide, please. January 2021 Journal of the Total Environment found that there are high mutation rates of coronaviruses and their ability to recombinate genetically, and that is something that is likely to be accelerating across species. And as we all know by now, the way that the pandemic has been approached in so many different countries was a big healthcare challenge for hospital staff, for hospitals, even the way hospitals were designed, and then also for people who have been cared for at home, or even people who lived alone who've been ill. Next slide, please. So we go back to how the environmental influence is in relationship to acupuncture practice. We see that acupuncturists use the 10 asking song components and 4 examinations all the time in how they treat their patients. Next slide, please. And next slide, please. Excuse me. Correlation was made from academia and Tong Xiang that COVID-19 with cold dampness was an ecological factor seen in TCM starting in 2019 and then going into the early part of 2020. Next slide, please. As mentioned before, we didn't find a significant correlation. However, over time, we've been able to see that climate change and weather have had influences on the spread of the virus. Next slide, please. Since we did our survey, we have seen that the incidence of different kinds of climate crises have risen. There have been increase in floods, earthquakes, wildfires, all kinds of environmental excess. And people have been affected by that. The coronaviruses have mutated, and there have been breakthrough infections as well as continued spread of the virus. Now, it seems that in many places the virus has receded. Next slide, please. So it seems that it's worth pondering. What is a good backdrop? What is a real backdrop in our medicine? Maybe there is some hidden relationship to an ancient philosophical construct and the way we think about treating our patients and the way we look at our patients for clues to what's going on with them. Next slide, please. This is a short list of what we can do to be astute practitioners and astute livers of life and astute acupuncturists. Next slide, please. I can be contacted through Five Branches University if you have questions about this study or anything related. Next slide. Thank you.